Welcome to the ninth episode of the Lebanese Physicians Podcast. And today we have a special guest, Dr. Ziad Hubayter, who is an in vitro fertilization specialist at the Lebanese American University Medical Center Hospital. I have known Dr. Hubayter for a very long time. Actually, we were together at the American University of Beirut Medical School, and then I worked with him at LAU for a couple of years when I was there. And it was a lot of fun working with him, actually. That's why I decided to invite him. Dr. Hubayter, welcome to the podcast.
Hi, Khalil. How are you? Thank you for having me. It's a great thing you're doing, and to keep all these physicians connected. So thank you again for having me and for this great initiative you're doing.
All right, thank you, Dr. Hubayter. Can you tell us a bit about yourself, where you trained, and how you ended up going back to Lebanon?
So I did my medical school in Lebanon at the American University of Beirut. Then I went and did my residency in obstetrics and gynecology at the George Washington University, where you are right now practicing. And then I did a 3-year fellowship in reproductive endocrinology and infertility, so IVF, at Johns Hopkins. And also I did some research at the NIH and all that stuff. And then I worked for a few years in private practice in the US before deciding to return to Lebanon. And I came back to Lebanon a few years ago. Want to be close to family, to home, and also a great opportunity to join the Lebanese American University and the Department of OBGYN here.
Great. And so basically what made you return to Lebanon is mostly the family connections that you have there, right?
That was the main factor, but also I wanted to be part of a growing academic institution, and to practice with the people that we know, that I grew up with. It's fun, and it's there's still a lot that we can do in return to Lebanon, especially in these times. It's even more important.
Right, exactly. And I see you're raising two great kids right now in the country. And so can you tell us a bit about your OBGYN practice in Lebanon? How has it been? How is the practice of infertility in Lebanon and fertility medicine and over the past years right now?
So the OBGYN practice in Lebanon is, and infertility especially, is a little bit different than the way it is maybe in the US. So in the US, the IVF physician only does infertility, while each one does its own subspecialty. Here in Lebanon, a little bit more of everything. Okay, but the things are changing, and I think it's better because it's good to have also the subspecialists taking care of the medical problem in that subspecialty. So now we have IVF subspecialists, we have oncologists, we have the high risk pregnancy, we have the different subspecialty within our field. But still, we are practicing. We do also the routine OB and gynecological problem, as well as the advanced, complex, and difficult cases of IVF and infertility. When we came back, initially things were still different, but then now, unfortunately, with the COVID situation, with the economic situation, many things have changed, obviously.
So yeah, I know also you've been promoted during your stay. You've been promoted to become program director of the OBGYN residency program, and I know you recruit a good number of residents every year. So now that you mentioned the economic crisis, has there been an effect of the economic crisis on your residents, and have they all stayed, or have some of them been leaving, going to different areas to train?
So when I joined the LEU as health program director back a few years ago, we were fortunate. We were one of the programs that had the least resident actually leaving our program. Indeed, we only had one resident that was already a prelim and he went to the US. But since then, we have not lost one resident, and we have like pretty much 100% retention, of our residents, unlike many other programs in the country. Okay, this is partly because we have our faculty. The majority of our faculty are actually American board certified, and so we are able also to take advantage of some affiliate hospital that we work with. So, for example, we have an affiliation with the Rafiq Hariri University Hospital, which is the referral center for corona. And so our residents have been also on the front line with dealing with pregnant patients with the COVID infection. We do take also, we model our program based on the US training, and we also give them the in-training service that is being done in the US. And this year they actually have scored really well with several residents reaching up to 2 standard deviation above the median. So we're doing really well with that. And most of our residents are getting afterward either a subspecialized training in France or in Canada, and some are applying now to even pursue a training in the US.
Excellent. Looks like that goes to how good of a job you're doing, I guess, with the program. Now, a question for you.
I wish I can take all the credit, but I think as the department, we're all doing a great job, I think.
Yeah, I agree. I know all the department. Everybody is great in it. And so, how has the economic situation and the COVID situation affected your IVF practice? Do you feel that people are still coming to do in vitro fertilization at the same rate as before, or do you think it has been affected by the crisis and the numbers are down at this point?
All right. So maybe because I'm new here, so I'm actually having more patients doing this procedure. Okay. So, but that's it's maybe my situation because I just started my practice a few years ago and it's growing every year. So in a way, I don't see maybe the impact as much, okay? But there is another thing that's happening with the economic situation and the hyperinflation in a way, the same way how people are going to buy things before they get, more expensive, maybe in 1 month or 2 months or 3 months. We are seeing that also in IVF, where people are coming and considering that maybe we should do our egg freezing in January before waiting till March, because in March might become a worse situation. So that's the egg freezing or in vitro fertilization for married couple. Now, egg freezing, a lot of people are coming and also talking about it and getting our opinion about it, because also with the COVID situation, people are not socializing anymore, and some of the patients who are like in the early 30s and mid 30s, are worried about whether they're gonna meet somebody with everybody in lockdown or not able to meet, and they are worried that they might not be able to get married soon, and so they are interested in doing the egg freezing procedure, which will give them the opportunity to, in a way, to be more relaxed about the pressure of time and getting married.
Right. Yeah. So basically, what you feel like is that people are trying to do it early on too, just because of they have the money now. It may be cheaper at this point. It may be more expensive later on, and some of them are actually using their money in the bank, I guess, in a way or another to do their egg freezing.
Now, obviously, the prices are much higher, and so it is probably becoming less accessible for people because, as you know, some people are still earning in the on the regular currency, and they didn't have an adjustment of their salary. So but again, some of my colleagues who have been here for a long time and well-established physicians have mentioned that they are not a decline in their overall volume of people actually doing the procedure. Sometimes people and ask, and then they might not actually end up doing it.
Right. And how's the COVID situation in Lebanon right now? I mean, I know it's been bad over the past couple of months, and the reopening just started. So, are your clinics completely open, or have you had to shut down your clinics for a while?
So I actually, I think it's dependent on each physician. We haven't closed our clinic, and but what we have done, because there was a rise in cases, especially after the holidays and Christmas and New Year's, and I personally end up not doing except emergency surgeries. Okay, I thought that it's the best thing is to avoid doing an elective procedure and getting a risk for the patient to contract, COVID from her, stay in the hospital and things like that. However, this has been very good recently, and so we are back to doing our routine, activities. Now, keep in mind there was a lockdown, so when in the second week of January, the cases were around 6,500 cases in one day. After the lockdown, the number have dropped. So now they are more like around 2,000, on average. But now with the reopening of the country, we are likely to see a rise in the cases. But thankfully, that at the same time we have now the vaccine, and so hopefully this will be able to balance that as well. Because the people need to work and people need to go to the activity, and especially with our economic situation in the country, it is even more important. And the other thing is that the hospital were really at the critical stage in January before the lockdown. So although the lockdown is not an answer, a long-term solution, I think the vaccine definitely is. And as a parenthesis, I recommend every patient people are worried about when they're pregnant, they get the vaccine. It's true we don't have enough data, but it's everything that we have so far is good and it's safe. And we hope that our patients who are trying to get pregnant, who are trying to go IVF, and who are pregnant, that they should not worry about the COVID vaccine. And but anyway, so the hospital are now a little bit more relieved. We are opening more closed. Specific for COVID, and at least we are not. The ER is open. At some point, it had to be closed.
Excellent. And how do you see? I mean, we always hear, like you're in Lebanon or you're outside of Lebanon, you always hear in the news the crisis in the country and everything that's going on. But then people live their life. I mean, if you're living there, you live your life maybe as close to normal as possible. How do you see the effect of this crisis moving forward, or how do you see it moving forward for the future of your residency program and the practice in the country?
So for our resident, we besides the COVID situation, we worry about that if the economic situation worsens, okay, that there will be less and less cases that we perform, because people may not have any more the means to pay for the surgeries. Okay, so that's one part. The other part also, we worry that there are physicians that are leaving the country. It's normal for people to each person has different financial situation, and so it's the same way how in every sector people who want to leave and get an opportunity are maybe leaving, and what's happening is that we are draining the knowledge and the brain of the people who are working in this country. So we hope to retain the faculty as much as we can, and this way at least the teaching and the training will remain. And also we hope that the situation does not worsen economically, so that we can still have the insurances, the patients that can, that can come and seek their care with us, and that will be great for our resident and for ourselves and for our patient, because this way they will have still a well-trained physician, and we still can provide training for the future physician of the country, and the patient will still be able to get a good care at home without having to go somewhere else.
Right. And if one harder question for you here, if people can donate to your program or to LAU, what do you feel would you need the most to have the best impact on your program to improve it with the current situation?
So you're saying if somebody will donate a donation for LAU program, like the OBGYN department, how will I use this?
Yeah, how will you use it, or what's the best impact right now? Because I'm sure there always help is needed at this point.
So so that's actually great, because I think we will use it in two ways. First of all, we can help at least the patient who need the money. Like, if they need a certain differential to be able to be taken care of, then that will be good to have a certain fund for these patients. Okay, so for women that are in need. Okay, so that will be one thing. Okay, so that would be great to give back to the society and to help the department and the institution. The other thing that can help also is, LAU is one of the pioneers in the region in simulation. Airplanes and the pilots, before they go and fly, they do a lot of simulation. Okay, so same thing in medicine, and this is becoming like a new trend everywhere, worldwide, where they are utilizing simulation and new technology, artificial intelligence, to improve the training and the skills of physician. And so with like additional funding will help us obtain the newest technology to build on our simulation program and simulation. And therefore, if there's any deficiency in, for example, a certain skill, then they can do that. And as a matter of fact, the USA has cooperated with the LAU and gave some help. And we were able to, for example, now a laparoscopy simulation, and we take our residents and teach them how to practice minimally invasive procedure and laparoscopic skills, the basic skills, and so. And they're very happy, and we enjoy it too.
Yeah, you reminded me of the stimulation program. It's a great program by Dr. Vanda Abirad. I've done the course with her, and it's a great program in Biblos actually. So they do a good job maintaining it. And I'm impressed, Dr. Hubayter. I think you're one of the physicians who are still there battling on, and you have a very positive attitude about it, which is needed right now in these circumstances. And I'm very impressed by you for doing that. So, in summary, do you want to say anything in summary about your program, about the practice in Lebanon right now, and about what people can do to help?
So, in summary, I think Lebanon is passing through a crisis, and we've been in the civil war. We grew up to the civil war, and we afterward. But unfortunately now, it's a different type of crisis. It's an economic crisis, and I'm certain that the resilience of the people and the belonging to the country, for example, people who are abroad still feel a belonging, a strong belonging to Lebanon, and still will contribute back, and many people are staying now abroad or leave the country now to for better financial or professional position, but I'm sure that they will give back also to Lebanon, and I think it is this type of giving back and belonging that the people have wanting to improve our, at least in the healthcare system, I'm sure in other systems as well, we will be able to recover from this difficult period and from Corona and the economic crisis, and to hopefully, build a better future for the future generation.
Exactly. And and just to finish it up, I think the best way to donate is to donate to LAU, right? To the university itself.
Yes, I mean I think there is a assistant, for the president who is responsible for all these things, and they're doing these things. Actually, they've done like something where they do auction for arts, and so because obviously this is important to keep the faculty and the student, and the student also are facing a lot of problem with the tuition, and I was just saying that the system, the process of giving is through.
Yeah, I got it. Yeah, I got what you mean, actually. Yeah, Dr. Hubayter, it was great talking to you, and I think it's great you gave us some of your. I know you're very busy, and it's good you gave us some of your time for this. It was great seeing you in person, or at least virtually, I guess. Virtually, exactly.
This is one of my friend was saying me a while ago that Zoom was created by who created COVID. Sorry, I asked the question wrong.
Who created COVID?
It's like the big pharma or whatever. So, but it's probably Zoom.
Right, because they benefited the most from this, and then they benefit for a long time.
Doing extremely well.
Exactly. All right, thanks.
I hope you will come back and see us soon.
Yep, I hope so too. Thank you very much.
Thank you, Khalil, and keep it up. We enjoy seeing all these interviews that you're doing, and hopefully we'll get a chance to do that again.
Yep, for sure.